welcome to you, Pam, because Pammy and I have been we've been mates for a little while now, and we always have very inspiring conversations when Pam comes to see me or when we catch up. And look, I'll put the boring medical disclaimer in place first, which I'm sure you would have done
Good.
anyway, Pam. Pam is not a medical person as such, but she's had a lived experience of lobular breast cancer. Good morning, Robin. And we there's this subtype of breast cancer. I think is there 16 to 18 different types of breast cancer. Is that right?
I wouldn't know the exact number, but it's a lot of lanes.
Last time I think I heard the number 16, but then someone said 18 the other day. So anyway, we've got all these different types of breast cancer, but Pam has become extremely passionate, for good reason, about bringing awareness to the differences with lobular breast cancer. It's a different ball game, isn't it, Pam? And one of the things we want to do today is just go through the research that Pam has dug up a fair bit on her own, and the people that she's speaking to who are making some huge ground in the research stakes in this space. So I've got my questions out, Pammy, because we were very conscious that we only had half an hour, and Pam's so passionate about this topic, which I absolutely love. I think when it comes to the space that is breast cancer, we need movers and shakers in this space, and Pam can move it and can shake it. So I really take it off to her. She doesn't know that yet, but she can shake it. Anyway, so Pam, do you want to give us a little quick background on what your, if you're comfortable giving us your personal background, sort of experience on lobular and whatnot?
Sure. I as an Australian, I happen to be traveling a fair amount for the last 20 years, and always did mammograms and ultrasounds, but they got a little bit a distance in between them. Always did ultrasounds because I had dense breasts, and so they always did the ultrasound. I often had needle aspirations or biopsies. They always came back negative. Having dense breasts meant that it hid a lot of things, and I now know that dense breasts can add to the formation of lobular breast cancer, but it can also hide it. So visually, it's like trying to find a marshmallow in a snowstorm. And you've got to be like, it shouldn't be. It annoys me that it is, but sometimes you just have to be lucky and get the right person behind that ultrasound working out the imaging. And I just happened to be lucky on that day. I'd fallen over. I'd come home from traveling and I'd had a really, really bad fall and ignored it for 18 months. I flattened my left breast. It was lumpy. It grew a big lump. And I just thought, oh, that's because I fell on it. I never considered anything else. And then luckily, and the surgeon said, once I'd had the double mastectomy, he said, your fall saved your life, because that got me an ultrasound as with someone who had to really look hard because of the size of the lump from the fall.
And can I ask a quick question, Pam?
Yeah.
You know how you said you knew you had density to your breast tissue. Was that something that someone had said to you way back, when you first started getting ultrasound scans, or was that something that how did that come about?
I'd gone back. I had a memory that people always said, you've got cystic breasts. I was the sort of person who couldn't go on the pill because I developed cysts. That's also something to watch for, cystic breast. But on your pathology, if you bother to read the fine print down the bottom when they explain things, it will use the word dense. It will use cystic breast. And they're alarm bells that I now know I could have paid attention to. In Australia, we don't grade the density yet. In Ireland, they're trying to push through with their government to get it graded. So on every woman's ultrasound and pathology report will be grade 1, grade 2. And what that means, that after I was diagnosed, I took my 3 daughters straight. I followed the radiographer. Wherever she was, I took a daughter to her and had them have ultrasounds and mammograms because, you know, I'm looking to see if they've got dense breasts because they need to be on the alert. The thing with lobular is that it is not a lump. And I taught the kids to, you know, do breast checks. And I failed as a mother to say, stand in front of a mirror and get to know your breasts. They're your best friend. You should be looking at them. You should be knowing, take a photograph, like know what they look like. And if you have a partner, that's very helpful because your partner might say, your nipple's a little skew-if, or what's that dimple on the side? So if there's something, a change in the look of the breast or the nipple, maybe an inversion, maybe a thickening, a line or a little thickening, something that changes in the look or feel, follow it up. It's not a lump. If it's a lump, it's ductal and it's in the milk ducts. If it's lobular, it's a line of cells and they're in the lobules, the milk-making glands. So that line, what happens is cells grow up like that, and then the atypical cell will drop off the top and come like the tail of a snake. So it drops off and it comes here, and they grow up and then it drops off. So you end up with atypical cell, 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 cell in a line. With lobular, that person doing the imaging notices that we lack a protein called, I've actually written it here because I thought people might want to see what I'm saying, E-cadherin.
Oh, right.
Now, on
write that in the chat if anyone's watching.
Lovely. On an ultrasound, normal breasts, it's easy to see what's going on in there. Lobular breasts lack that protein, so they look brown and white. We lack the brown, they look white. So that's why I said finding a snowball, finding a marshmallow in a glass of milk in a snowstorm. That's what those people are looking for, because those cells don't stick together. When they stick together, it's ductal. When they fall into lines, it's lobular.
And I was reading last night, Pam, I know you've told me this before, but it's about 15%, correct me if I'm wrong on that stat, that actually get diagnosed with lobular breast cancer, but it's actually the second most common breast cancer behind your hormone positive.
Yeah, more common than uterine cancer. And yet, as a woman, I thought breast cancer was breast cancer. I never knew that there were all these different lanes. The analogy in my head now is a athletic stadium. And
sorry, sorry, Pam, I think I said that wrong before. So not hormone positive. I beg your pardon. I meant ductal carcinoma. Yeah, so it's ductal carcinoma is your most common type of breast cancer, followed then by
is.
Yes, sorry. Didn't mean hormone
it
positive.
Is. And lobulars are 10 to 15%. So now I just think, oh gosh, I felt for somebody who had breast cancer, but I didn't even know that it's all different based on whether it's being fed by estrogen or progesterone, if it's HER negative, all these things. Now, all of a sudden, you're supposed to become an expert in something because a doctor or a medical team might ask you what you want to see as your treatment. And you're thinking, I have no idea. I don't even know what it is. So
you feel like you've got to go into a university degree to get sort of half an idea of what should or what might have to happen. It is tricky, isn't it? Because I appreciate why they do it. I think there's a big swing in the medical system now where there's a lot more patient-centered care is what they sort of refer it to, and I think that's a good thing, but it does make it a little bit complicated at times for the patient to help be part of the decision-making process, because you don't know what you don't know, and there's a lot to know about these subtypes.
Plus, we all have the right to be us. You know, we're more than cancer. We are who we are. So there are a lot of, I'll say women, because I've yet to I know men get this. I don't have any in the Lobular Australia, the group, our group. I yet to have a man, so forgive me if I say women. But there are a group of women who are really happy to be guided by the medical team. And will do, and just say, you do what you're going to do, and I accept that. And then there are a group of people who want to be part of it, but investigate it. And often women, well, I found in my experience that people in a medical field sometimes say, don't Dr. Google, don't go to, and they make it sound trite. You know, don't go to Dr. Google. But there are a lot of us who are intelligent people who want to investigate well-researched, scientifically based, evidence-based information about what could or could not shorten our life, and that we actually find reassurance in doing that, or joining like-minded groups. So that people, Jen, you've got a great group of people with breast cancers, variety of them. And so they're around like-minded people and ask questions of the group who don't give medical advice, but just share their story. And then people take it from there. So it's a huge audience, but I had to get my head for my story around this lane called Lobular.
And I think the Googling side of it, Pam, is interesting, isn't it? Because I think, unfortunately, one of the reasons people will go onto the internet to find out information is because they're not getting enough information sometimes, not all the time, but from medical teams, or other health professionals for that matter. That's not to say you shouldn't cross-reference it with a medical professional, but I think you've also got to find a group of medical professionals that you trust and you can put some faith into to know that they're giving you the best possible up-to-date information. But it's tricky. Like that's not an easy thing to do. Some people are very restricted as to which health professionals, medical teams they can access.
Very much so. Plus, if you're regional, like you get that person, whether you like that group, that team or not, that's it. There is no choice. And then for some, insurance might dictate which path you take in your lane. Like I went university hospital as a public patient, and that means you've got time, you've got a difference in the time. Some women end up in hospitals within a week, and it's bang, 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 bang. So their mental, they've got to match their mental positioning with their physical positioning. And that can be very stressful because once they're home again, they've got to do a catch-up. Some people in the public system, they have a 30-day thing where within 30 days, you're going to get an appointment, and then you get your first appointment. And me, of course, had all of this happening Christmas, New Year. So all of that changes. So for people who are diagnosed in the public system, at that time, you lose weeks because of holidays and doctors not being there. So that adds to it. Plus, if you ask a question or want to have a second discussion, that added 30 more days to me. So diagnosed in November, surgery in March. I, at that point, wasn't particularly bothered by that because that gave me time to research and think about it. But it depends. Lobular breast cancer, I got greeted with, oh, you got the lucky cancer. And I mean, in hindsight now, I find that shocking now to be told it was the lucky cancer, because that particular young resident had read something that said lobular is slow growing. And I want to say lobular may be slow growing, but lobular can be aggressive. So you have to find out about your lobular. And there's this test. I wrote it down, the Key 67.
I'll pop that in the chat as well.
Yep. Great. That test tells you basically how aggressive. These are all the tests that you can ask for. You can have this. I knew none of this because my lobular was being judged or evaluated based on ductal studies. And once I understood that my lane was not ductal, I kept saying, are these studies based on lobular patients? And they're giving me percentages based on ductal. And I just kept asking about what have you got to assess my aggressiveness or stage or grade based on lobular. We have a long way to go, but we're going to go there. That's where we're going to end up with a national guidelines. That's in my head as a goal, national guidelines for diagnostic differences.
So for anyone who's joined us recently, Pammy, so basically the one of the messages you want to put forward is that through your experiences of lobular breast cancer, particularly in the way, you got your diagnosis and the whole picture of the diagnosis, shall we say, from sort of early scans to pathology to histopathology or whatnot, is that you're sort of dealing with a different beast. It's a very different presentation. It's a very different it's almost a different type of it's a different type of breast cancer.
It is.
Yeah. But I know that sounds like an obvious thing to say, but it's there's a lot of caveats to lobular that are sort of almost unique features, if you will. Like I remember the very first time someone talked to me about lobular and they said it's like a spider's web. You don't feel a lump, you don't find a lump until it's like very, very far advanced lobular, if that's correct.
Yes.
And that and that essentially, doing a breast check doesn't just involve searching for a lump. It's got to involve, visualizing and noticing changes, but obviously also going for your scans. Can you speak at all to your experiences, Pam, about, I know we've had these discussions a number of times about the role of MRI scans in lobular.
Yeah. So I'm going to keep that.
Yep, jump backwards if you need to.
Yeah, I just want to say, I went to a symposium in Pittsburgh last year, International Lobular Symposium, and I was asked to stand up to represent lobular as a 70-year-old white woman. This is often when lobular gets diagnosed. I personally now know from the Facebook group that we have a lot of 30, 40, 50, 60-year-old women in the group. But more often than not, nobody finds it. Even though we have those regular mammograms and ultrasound, it goes undetected because it's difficult to find. And therefore, by the time they find it, your tumour, your invasive tumour, is more than 5 centimetres. And that 5 centimetres is like a watershed. Under 5 centimetres, that's what you hope to find it under. Once it goes over, a lot of your treatment options alter based on that. But if nobody's finding it because we're just going along for a mammogram, and I know of some women who choose after a certain age not to have mammograms because they're getting older and they just think, well, why bother? Well, you bother because this can make a big difference in your life that you didn't know about. Now, come back to your point, testing. Always encourage family, friends, relations to have an ultrasound. That's my number one thing is mammogram, fine, that's great, but ultrasound for lobular. And the fact that 15% of us have lobular, you don't want it to go on and on and on. And then women around the world are offered better imaging than we are here in Australia and New Zealand. We get offered ultrasounds, but you can push for other things. You can push. Sometimes I got a PET scan, CT scan, bone density. They're good things. And you need to keep watching because the second thing about lobular is, yes, it's hard to find because it's going like this, not like this, but also, and you know, it's sad, it has a high recurrence rate. After 5 to 6 years, lobular likes to go somewhere else, and you need to be watching for it. Not all women get recurrences. 90% of us make the first 5 years fine, but maybe 20 to 30% after that might recur, and you want to be on top of it. I'm fighting for, like American women get, brain to thigh MRI. I get laughed at, basically. I write letters, I hand letters to the people who are my team, and because I'm public, I request a yearly MRI. I want an ultrasound in June. I want an MRI in December. Ultrasound, MRI. What happens is they'll give you an ultrasound once a year for 5 years and then say, off you go.
And
but
in your
lobular, we
experience,
can't go off.
yeah, and in your experience, Pam, is the pushback? Well, what do you feel has been the pushback in terms of the ability to get certain scans done?
Oh, it's money, the cost of that, hospital budgets.
Yeah. So
and I get that, but
evidence.
I will gift it to me. I had two things that were I gifted to me when I kept asking questions about, but what about lobular? I got offered the Key 67 test, and that came up as my lobular was aggressive. So instantly they said chemo. And if you have an aggressive cancer, chemo is a good thing, because if I give you an analogy of going to a national show with that duck, the duck shooting gallery, right? And the ducks come up and you've got the BB gun. If you've got an aggressive cancer, you're getting a lot of ducks up there. So if you're going like that with chemo, you're getting rid of a lot of ducks. With lobular, if you've got a slow growing lobular, one duck comes up, then another duck comes up. And chemo is not necessarily your best option for slow growing lobular. But if you've got a lot of ducks, chemo will be offered to you. And sometimes people go, oh, they've read, chemo's not recommended for lobular. Yeah, you have to think about it if you've got lots of ducks up there. So if it's aggressive,
So it
and the
depends
Key
on your
67,
individual circumstances, is what you're saying there, Pam. Yeah.
Ask for the test. Ask for the Key 67 test to tell you your speed at which your lobular is progressing. Then I did that. So I had a high number, so it's aggressive. So on this hand, instantly, I've got the date. Come next Tuesday, here's your chemo. And then I asked a question about that in relation to lobular, and the next highest medical oncologist came into the room, and she said, we've had a little conversation, and if you pay, I think it was $3,600, this is Australia, you can have a test called Prosigna, which is the PAM 50 turned out to be, and that's a genomic test, and then that gives you more information. Will chemo make a difference to me? And it came back, no, it wouldn't. I had such, my genomic results said it wouldn't make a difference. So even though it was aggressive, it wasn't going to make a difference, the chemo. So that sort of intelligent research helps you and your team figure out what you need. But do they offer it? No one mentioned it.
And I suppose that's the thing, is that, like, unfortunately, I've been, as many of you know, and certainly Pam knows, I've been working in breast cancer rehabilitation now for 10 years, and I'm not a medical professional, as everyone knows, but I think unfortunately one of the really common stories that we run across too often is that it's a situation sometimes where the squeaky wheel only gets the oil. You really have to push hard sometimes. I'm not saying this is everyone's circumstances, but Lobular is a really good example. And I think Pam's experience is a very good example of this, where she had to push and push and push and do a lot of work, hard work on her own to get more information. And it annoys the hell out of me that this has to be the way. You know, I have patients come in often who are very frustrated when they feel their medical teams particularly are withholding information that they could empower the patient with, you know, for example. And you know, I'd rather, I don't know about you, Pam, I'd almost rather they be honest with you and say, look, if you can afford to go and get an MRI scan on your own, we'd recommend that, you know, because this is going to be better imaging or something for Lobular. There's no budget in the hospital funding right now to provide this, but here's your best option. You know, actually empower people rather than hold it close to your chest and go, oh, this isn't going to happen, you know.
I think the frustrating part for me, as I've researched more, is that Australia and New Zealand, but Australia is just slow. You know, women overseas, they also get the kid, everyone, they get this. They get the oncotype test. They get mamma prints. They get EndoPredict. And this is the one I paid for.
Let me
that
just
was a lot of money.
Chat, Pam. I think I've got in the chat the Key 67, the Pro Sigma, the Onco Type DX.
And these are genomic tests, you know, they're going, it's biohacking, it's personalized medicine. And that's where we're going. And I want to be hopeful. And I'm going to Brussels this September to the second Lobular Symposium that brings together medical teams, researchers, amazing people on the cutting edge for Lobular, plus patient advocates. Like the experience in the room is just incredible. And what they're doing for research is so wonderful. We've got UQ in Brisbane with Dr. Pete Simpson and Dr. Amy Reid, and they're doing biomarkers. Their research is just take a blood. They're just going to take blood. But, you know, my great-grandchildren, those girls and boys will get a blood test and they'll be able to pick up lobular breast cancer. Like, what a gift in the future. But right now for us, Australians, we have to ask for it, push for it, if you've got the energy. And when you don't have the energy, just join a really well-respected group and let them push for you. You know, like just join groups where you're getting medically researched, scientific-based evidence, and save time. You know, actually, save your time.
On that note, Pammy, can you tell us about the
time
support? No, that's right. We can. Can you tell us about the support group that you've set up on the Sunshine Coast and on Facebook?
Yep. So it's lobular breast cancer. I Googled. I didn't Dr. Google. I Googled lobular, and up came these wonderful groups. Nothing for Down Under. We had no personalised support set up. And I've been really fortunate in my life to be around amazing women, like-minded women for other things. So at one stage I started Reflux, which was an an Australian Reflux Infant Support Association. Then I got involved with the Fabulous Nursing Mothers, which is Australian Breastfeeding Association, and was fortunate enough to be a state president. So groups of like-minded women can be very powerful. So 4 days before the operation, I just thought, oh, there's a lack here and I need to do something. So I started and called it Lobular Breast Cancer Australia and New Zealand, and qualified it with knowledge and kindness. And it's a small group, but we started with 3 and now we're 500, nearly 500. And I don't want the group to grow. I want the group to diminish. But we need a group. We need the power of a group. And on the 15th of October, October's Breast Cancer Awareness Month, and on the 15th, because 15% of us are lobulars, we have a global lobular awareness day. So around the world, America, Europe, Ireland, UK, we are going to push for that day to be recognised. And this year, 2024 in Australia, that's going to look like lab tours in Brisbane. Down south, it's going to look like something else. But even if you just get a group of your women friends together and talk about, or on Facebook or on Instagram, mention the word lobular, because people don't know it. Who knows that? And start to build an awareness that lobular is a subgroup. And around the world, when you go lobular, there are brilliant groups: Lobular Alliance, Lobular Breast Cancer Alliance, UK, Ireland. Ireland's big. The gorgeous Siobhan Freeney has dense breasts and knows that dense breast is an indicator to be aware. So she has Lobular Ireland as well as dense. So we have to push for our pathology to give us a rating on density of breast tissue.
And
so the 15th of October special.
We better
and
get
maybe
you back
next
on in 3 months when we've got that day coming, Pam. You're looking to potentially put together a conference for Australia around lobular. Tell us your plans for
that. I thought it might be winter next year, but I'm being flexible. It might be winter the following year, but just get together, patients. And we don't have lobular specialists. I wish we did. We do have lobular researchers. So like in Brisbane, we do, and they're phenomenal. But nobody's stepping up in our area of the world as lobular specialists. But there are still people who know their stuff. So get together on the Sunshine Coast in Melbourne, don't know, but let's start having a conversation, patients and medical people, about lobular.
That's awesome, Pam. And I think everyone can be very impressed by your enthusiasm and your passion towards bringing this topic to light.